Hello guys, welcome to my channel. Today I'm going to discuss the topic role of doctors in a case of suspected poisoning. This is one of the most important question in forensic medicine. So it's a like you can get it as a long or short. And see the role of a doctors, like doctor means registered medical practitioner in case of suspected poisoning. The doctor has medical as well as legal responsibilities. He has to treat the patient, at the same time help the police to determine the manner of death. So the doctor has two functions. One is the medical and one is legal. Firstly, in medical he have to treat the patient, and in legal he have to help the police in understanding the manner of death. Firstly, in medical, first we'll discuss about the medical. Medical, treat the patient. The doctor should start treatment as soon as the patient arrives to the hospital. Firstly, doctor has to ask the history. Next, symptology. Next, treatment. Like symptology means you have to see for all the signs and symptoms, and he have to start his treatment. He have to go for the diagnosis, like what poison he had consumed, and based on symptoms he have to like identify the poison, and he have to start the treatment as soon as possible. In the history, the doctor should take history of the patient, or if at all the patient is like not conscious or well, he can ask the attendants if the patient is unconscious. Like what questions doctor has to ask is like whether he has consumed tablets or liquid or taken injection. So mainly you have to ask about the route, like whether he have taken it in the, like whether he inhaled it or whether he taken it as injection, or whether he had added the food, so whether he had taken tablets. So we have to ask him these questions, and the quantity of tablets or liquid consumed. Then we have to ask the time of consumption and the previous history or medical or psychiatric history of the patient, because many people who had depression or psychiatric history, they're more prone to do all this, like suicidal attempts. Next, symptology, quick analysis of the symptoms and diagnosis of the poisoning. So based on the symptoms we have to identify the poison. You have to start the treatment as soon as possible. Treatment, assess the condition of the patient based on the levels of consciousness, respiratory failure and circulatory failure, and treat the patient as described under the heading general lines of management of poisoning, that we'll learn later. Doctor should not allow anyone except hospital nurse to administer the medication and nourishment for the safety of the patient. Now, doctor should maintain written records of his findings and treatment. This is useful to the physician in the court. So you have to maintain all the records, like what treatment he has given, and he should only his nurse have to be there for the treating and giving food for the patient. You should not allow other people, because there are chances like they may give poison to the patient. Like he may have enemies, no, the patient may have enemies. So yeah, so you should not allow anyone like people outsiders into the treatment or hospital, like while the patient is getting treated. So and now legal. In legal, assist the police to determine the manner of death. Firstly, you have to there are like 1 2 3 4 5 6 7 function you have to do. That is, you have to take the preliminary data, inform the police and collect and preserve. Next, dying declaration, court, death certificate and public health authorities. Preliminary data, like we have to ask the like data, like his name, his age, his residence, is all, and you have to know the identification marks of the patient. See, preliminary data, know the preliminary data of the patient, that is age, sex, identification marks, address, date and time. Next, inform the police. This comes under section CRPC. So in this says that a government, if at all you are a government doctor, so you got two cases, like you got a like poisoning case to your hospital, or a homicidal case like you got a poisoning case to your hospital and you came to know that it's a suicide, or you came to know that it is a homicide. So if you're a government doctor, you have to inform the police whether it is suicide, homicide or accidental poisoning. But if you are a private doctor, so you have to inform only when the poisoning is a homicidal. So you need not inform if at all it is accidental or suicidal. If at all it is homicidal, you have to inform the police near your hospital nearby. See, inform the police. It comes under section 39 CRPC. You have to remember this. A government doctor is bound to inform the police officer of the nearest police station about the cases of suicidal, homicidal or accidental poisoning, and the private medical practitioner should inform the police officer of the nearest police station about the case of homicidal poisoning only. Non-compliance is punished under section 176 IPC. Next, collect and preserve. In this, if at all you'll just collect you'll collect the samples, like you'll do urine test, you'll do blood test, you'll go for the examination of the stomach content. So if at all you have any the poison present in that contents, you have to preserve them. That is comes from the collect and preserve. The following, like we have to present because of evidence. The following as evidence, section 201 IPC. These sections are very important. 201 IPC and section 39 CRPC. Vomit, stomach wash contents and samples of urine and feces and suspected food or drink or medicines in separate glass bottles. We have to preserve them in a separate glass bottles and give a label with the name of the patient. We have to add a label to that glass with the patient's name for the easy identification and all. And the material preserved, date and time of examination and kept under his custody until it is handed to the police officer for chemical analysis. So you have to preserve the materials in a clean glass jar, and you have to keep his name and mention his name and date of time of taking the samples, and you have to preserve it until you hand it over to the police. So they use it as evidence. If it, like in case of poisoning and all, it can be used as evidence. Next, court. If a doctor is summoned for the court, he has to give information about the case. If he conceals any information, then he is liable for prosecution US 202 IPC. If he supplies false information, he can be prosecuted under 193 IPC. I think this is not important, but if at all the court calls the doctor for giving any evidences, or a doctor have to go and give his provide his evidences for for giving any justice, for identification of any giving any identification of person in the court. Next, death certificate. If the patient dies, he should not issue a death certificate. If a patient dies, he should not issue a death certificate, but he should inform the police and hand over the body to the police officer for further investigations. See, if a person came to a hospital, he died, and you should not give a death certificate then and there. You have to inform the police, then you have to give the death certificate. Then public health authorities must be noticed in case of mass food poisoning arise from the canteen or mess or hotel. That's it, and thank you for watching my video. I hope you liked it.